for healthy, the implementation of the Madrid Action Plan, as well as other ongoing efforts in advancing the effective protection and participation of older persons. UNITAR remains at your disposal in case you would like to explore possible synergies to prepare learning initiatives on this important topic. I warmly encourage all of you to send your questions and comments to the speakers through the Zoom Q&A tab. Today, we celebrate the fourth event of this year, entitled Accountability and Redress in Cases of Intersectional Discrimination Against Older Persons. Why we have chosen this topic? Older persons experience discrimination that is not only limited to age, but also compounded by gender, disability, ethnicity, socioeconomic status, migration background, among other identity factors. These intersecting forms of inequality heighten the risks of exclusion and limit the ability of older persons to fully exercise their human rights. In this regard, we brought up this discussion to share some challenges and opportunities faced by older persons to overcome existing gaps in access to justice and to explore how legal frameworks and institutional mechanisms can be strengthened to provide effective accountability and redress for older persons facing intersectional discrimination. Without further ado, let's welcome today's wonderful panel. We will be starting with Madame Roxana Bittmer-Iliescu from ITU. She's the head of Digital Inclusion Service of the International Telecommunication Union, a very dear friend from the UN. She has dedicated 27 years to the Development Bureau of the International Telecommunication Union to advance the global digital inclusion agenda. As head of the Digital Inclusion Service, she advises ITU members and leads the development of inclusive digital policies and strategies. As passionate advocate for digital accessibility, she champions human-centered and digitally inclusive technologies and spearheaded the development of more than 75 ITU-D key resources aimed at fostering implementation of available, affordable, and digitally accessible technologies. Prior to joining ITU, she served in the International Relations Department of the Romanian Parliament. She has a legal background with a specialization in strategic management of telecommunications. Dear Roxana, please, the floor is yours.
Thank you very much, Ana Lucia, distinguished and esteemed colleagues, participants, ladies and gentlemen. Thank you for the opportunity to speak at this key event on intersectional discrimination faced by older persons. As we know, older persons often face overlapping discrimination due to their age, gender, disability, and socioeconomic status. So this discrimination is compounded by gaps in legal frameworks, limited awareness, and insufficient access to information and communication to enable a just discriminatory-related mechanism. Today, I would like to focus on how information and communication technology, what we call ICTs, can play a crucial role in supporting accountability and redress for older persons facing such intersectional discriminations. And this is what ITU work focusing on, addressing the digital divide and ensuring the ICT's solutions are digitally inclusive for all people, regardless of age, gender, ability, or geographical location. So we can equally and equitably also empower everyone, including older person, to fight whatever type of discrimination they may face. So this brings us to the central role, actually, that information and communication technology can have in transforming the experience of older person who are facing this intersectional discrimination. And I believe we all agree that this can serve as a powerful catalyst for change, unlocking new avenues for inclusion, legal access, and advocacy. By bridging gaps to secure affordability to access to internet and the appropriate digital equipment, creating digital accessible services, application, and content, ICT holds the potential to facilitate and improve older person access to justice, enhance transparency, and ensure accountability in ways that traditional mechanisms often fall short. And digital technology also offers new avenues to seek redress where all these methods may not be accessible. So from our perspective in ITU, ICTs are not just a tool for inclusion, but it's also essential for people empowerment with the aim to increase the quality of their life. Because everything we are doing with technology, with the specific of our work, why we are doing it, we are doing to ensure that we increase people's life, that we are here to respond to people's needs. So now let's explore how in concrete this ICT can directly address the challenges older person face in seeking justice and how it can support our collective efforts in creating a more inclusive digital ecosystem tailored for this important category of end user. Because as we all know, the world is getting old. And looking farther ahead by 2050, so it's tomorrow, older person 60 plus are expected to represent over 22% of the global population. So these are the last figures provided by our colleagues within the UN and the World Health Organization and other related reports. So it's a fact. And I would say that from our perspective, I would mention at least 4 to 5 key issues. The first of all is bridging the digital divide by ensuring physical access to digital information. So we all know that older persons face barrier in accessing this digital technology, whether due to lack of affordability to pay the internet services and devices, or because the accessibility of the devices, services, of the content. So to be able to navigate safety in this digital space. And I just want to make a short pause for those who are less familiar, what I really want to address when I say accessibility of the devices. I'm referring to the smart technology who have accessibility feature embedded in the device. So that means if I have age-related disabilities, visual or hearing related one, I can use this device as anyone else. So this exclusion limits their ability to participate in today's society, which, as we all know, it's increasingly digital. We want it or no, this is the world we are living in. And so by limiting this access, this actually can be very critical because can refer to a health-related issue, as we all faced during COVID, when most of the information was providing through digital platforms, but even more because we are transferring our activities and even human rights from analog to digital. This can also further affect the human rights of older persons, so the exercise of their human rights as anyone else. What can be done? At least 2 things. Provide affordable access. So policies for providing affordable devices and internet connection for older person, it's absolutely crucial. And ITU supports initiative aiming at making internet access universal and inclusive, but this effort cannot be implemented without, let's say, both efforts, top-down and bottom-up support. Which should ensure, for instance, that governments can consider strategies that address these potential financial challenges that this end user may face, for instance, either by including older person as beneficiary of the Universal Service Fund, or ensuring other national strategies and mechanisms that guarantee the affordability aspect it's addressed for this end user. And then the digital literacy programs. So targeting training to improve digital literacy among older persons, including understanding the way to navigate safely in the digital ecosystem. As a result, to be aware of including their digital rights, it's also essential. ITU has a long history in promoting digital inclusion and doing such type of literacy programs, and we are very happy to mention that in the last 3 years we work very closely with universities like Juventus University in Japan, who are addressing this type of training programs through universities, and we also managed to do through these programs a sort of intergenerational support. So we truly believe that this is essential and key to ensure that all this ICT can empower, or this information and communication technology can actually empower all the person and giving them the means to engage fully in society and access critical information. The second one, it's about accessible legal frameworks and e-justice platforms. So older person often struggle to access legal services, either due to geographical distance, either financial barriers. So again, we do believe that ICT can bridge this gap by creating digital legal platform to help older person file complaints, seek advance, and access legal resources. Again, concretely, what can be done? Ensure that these e-legal services are provided by the governments, and governments can invest in e-justice platform where older person can easily access their legal support online, and of course include features that can facilitate for some specific end user like older person their intervention and navigation in this platform. Also, from the end user's perspective, I think, again, top down, bottom up, public awareness campaigns are also very important, because we also have to be aware where we find this, how we access them, and even simply that this exists for us. In general, in ITU, we are also trying to work with partners and to raise awareness with our ITU members to ensure that this digital platform and e-government services cover all these type of services that are critical for older person. Of course, when I say e-government services, this is one of it. Is also related to e-health or any other service that it's critical for this end user group. The third one I will mention about accountability and transparency. I believe that a lack of transparency in legal system makes it difficult for older person to hold institution accountable. And here again, with the evolution of the emerging technology, I think ICT can increase transparencies and offering reports platform for discrimination and tracking system that monitor the effectiveness of to redress all these mechanisms. So in concrete, what can be done or should be done? Perhaps have these digital reporting platforms, to develop platforms to report the abuse or discrimination safely, and also to track the responses. And this platform can also gather data to identify systemic issues and avoid them in future similar context. And also data analyzing and monitoring. This is very important because governments, but also NGO, can use this data analytics to track cases of intersectional discrimination and advocate for reforms that can address all this. Again, by harnessing the power of data analytics and digital reporting, ICT allows us to monitor the incidence of intersectional discrimination and track the effectiveness of policies and redress mechanisms. So the last but not the least one that I would like to focus on is advocacy. How we can empower older person through better addressing advocacy. I do believe that advocacy is key, also to strengthen legal framework for older person and strengthen knowledge in general for older person rights, including related to information and communication technologies. Because why including related? Because as mentioned at the beginning, considering that our human rights normally have now a component, a digital component, accessing technology will be an impediment, if it's not there, to exercise my human rights. So all this is it's interlinked, and that's why it's so important that when we address older person human rights, like everyone's rights, to ensure that we talk about the also about the digital space, where now all these rights have been gently but surely migrating, and we all are facing part of the human right exercise also done through digital platforms, like the voting, that taking an appointment to the medic, and so on, financial payment, and so on. So I believe that social media campaigns are very important, and use of digital tools to raise awareness of all this intersectional discrimination faced by older person, and to call for policy change. For us in ITU, the most important, and I think that our presence here from the last 4 years, as the colleagues know, it's collaboration. Collaboration, it's key. And NGOs and international organizations can collaborate through ICT to amplify our advocacy efforts from both sides. And finally, I would say that ICT is not just a tool for legal redress, but also for amplifying the voices of older person globally. And through digital advocacy, we can create wide-reaching campaigns that foster greater public engagement and policy change that usually we can do it without the digital technology. Of course, we do promote this advocacy by empowering marginalized group to use all this tool. But to conclude, acknowledging this power to transform the way we address intersectional discrimination against older person by ICT, and by improving digital literacy, creating accessible legal platform, and leveraging technology for transparency, advocacy, we can ensure that older persons are no longer excluded by compounded discrimination. As we look ahead, I believe it's important to strengthen our collaboration, to prioritize ICT solutions that can empower older person. And for me, they are, as said, a catalyst that can make our legal and social system more inclusive and more equitable. We remain committed to advancing digital inclusion to ensure that every old person from today and future generation can have equal and equitable access to information and communication technology, and be empowered through this to be able to participate in the digital society, economy, and digital ecosystem as a whole. I believe that together we must work to ensure a just, inclusive, and accessible world for older persons, where their rights are upheld, their voices are heard, and their dignity is respected. Thank you for your attention.
Thanks, Roxana, for highlighting the importance of affordable and safe ICTs tools, as well as strategic partnerships. As you say, ICTs are tools not only for inclusion, but also for empowerment and raising awareness, including for accountability and advocacy. Thank you so much. Now we continue with our next speaker. We have the pleasure to warmly welcome Madame Kylie Shae. She's the team lead access to medical devices and assistive technology of the World Health Organization, WHO. And she's responsible for operationalizing the 71st World Health Assembly resolution on improving access to assistive technology and mobilizing the global assistive technology sector through GATE, the Global Cooperation on Assistive Technology. As an occupational therapist from Australia, Kylie has worked in disability and international development since 1991, with a strong rights-based and equity-focused approach to inclusive and sustainable development. After working with a British-based NGO on development projects in multiple low-income countries, she founded Motivation Australia, leading it for 13 years to strengthen rehabilitation and assistive technology services across the Pacific. Her work involved close collaboration with governments, service providers, disabled persons with disabilities, and its representatives and policymakers to build sustainable and inclusive services. In 2019, Kylie was awarded an Order of Australia medal for her work in the Pacific alongside her current role. Kylie is pursuing a higher degree in research at Flinders University, Australia. Please, Kylie, you have the floor.
Thank you very much. And the first thing I would like to say is I apologize for the length of my bio. So I need to make a shorter one for you. I'm just going to share my screen because I've just got a few slides that kind of illustrate what I will share with you. So hopefully that's coming up now. Can you see that? It's all good? Great. Okay. So good morning and good afternoon. And thank you very much for the opportunity to contribute to this roundtable. I was really delighted to be invited. Today, I'm going to be talking about the role of assistive technology in supporting older persons. And I'll be drawing my points from the findings from the World Health Organization Global Report on Assistive Technology, as well as recent policy and program development since 2022, when that report was launched. And my aim is to really highlight why assistive technology is essential for older persons, the barriers that they face in accessing it, and what we could be doing to address the current status of inequitable and inadequate access. But first, I would just like to begin by clarifying what we actually mean by assistive technology as a term. So it is a term that encompasses assistive products, as well as the systems and the services that support or enhance a person's access to these products. And assistive products themselves are a very broad range of devices that are specially designed or readily available, and that support individuals with any form of functional impairment of any age. For older persons, assistive products can include those devices commonly used by older people, such as walking aids, wheelchairs, hearing aids, vision devices, and of course, digital solutions. And they're all vital supports for enabling many individuals, no matter their age, as I said. From a WHO perspective, access to assistive technology is not only a human right, but it's also a core element of universal health coverage. And the global report that I mentioned right at the beginning highlights that 2.5 2.5 billion people worldwide need at least one assistive product. And that is a figure that's expected to rise to over 3.5 billion by 2050 due to the global population aging, of course, and the increasing prevalence of non-communicable diseases. However, statistically, among adults, with that 2.5 billion across the whole population representing 1 in 3 people, but amongst older adults, the need is even more acute. So at least 2 in 3 people aged 60 and over need at least one assistive product, with that need often rapidly increasing to multiple products as people age. And this includes people who are experienced users of assistive technology, who are experiencing changes as they age, which requires modification of their equipment and possibly new products. A long-term wheelchair user may well start to need a hearing aid. And these devices, as they duplicate and multiply in use, need to speak to each other and need to work with each other. People also might experience with functional decline changes in the postural support that they might need if they've been a long-term wheelchair user, for example. But then amongst the group of older people, we have those who are experienced users of assistive technology. And then we also have people who are experiencing the use of assistive technology for the first time. And often for them, that can be a very different and sometimes confronting experience. So timely access to appropriate and affordable assistive technology, the products and the services, is fundamental for older persons to live independently, to participate fully in society, and to retain their dignity and independence. And for all, assistive technology is often crucial in preventing or mitigating the impact of health conditions. I'm from the World Health Organization, so that health element is absolutely critical for the work that we do. But as an example, WHO data shows that 62% of those people with a hearing loss globally are over 50, and yet hearing loss often remains unaddressed. And if we think about that in the older population, there is very clear evidence of links to maintaining hearing ability, supporting cognitive health, and reducing the risk of dementia. And so this gap in access to hearing aids is really significant when it comes to independence, capability, being able to continue to be involved in society, but it also has direct impacts on health. And yet, despite its importance, access to assistive technology continues to be hindered by significant barriers, such as, just to mention a few, there's very limited service provision that specifically targets older people, insufficient training among health and social care providers to identify and respond to the need amongst older populations, lack of integration into policy frameworks, discriminatory gaps in funding mechanisms, and issues of acceptability from the perspective of older people are also really important and barriers. And related to this very last point and on service delivery as well, older individuals are rarely involved in the design and the decision-making processes for assistive technology, and that results in products and services that are not fully meeting their needs. And so now in terms of the way forwards. So the WHO Global Cooperation on Assistive Technology, so GATE, as was introduced in my bio, has developed, it's a community of practice, and together that they developed this 5P framework, which essentially offers a comprehensive strategy for improving access to assistive technology for everybody, including for older persons. And the framework is structured around 5 key pillars. And what we're saying with this framework is that in order to have a sustainable, practical, implementable solution within a country to ensure access, you need action across all of these 5 Ps. So we need to put people at the center and think about their needs. We need to think about the products and the supply chains. We need to think about personnel, and we need to think about provision systems, and we need to think about policy. Now, because the time in this presentation is quite short, I'm just going to touch on a couple of quick examples across that framework before I conclude. So in terms of thinking about people, what we would see is that there needs to be a greater emphasis on actively engaging older persons and their families at every stage of assistive technology research, design, development, service provision, policy making, and monitoring and evaluation. And that meaningful participation is absolutely essential to ensure that products and services are acceptable, that they're effective, and to counteract stigma and ageist stereotypes. And special consideration needs to be given to older women and those living in rural or remote areas, and older people in humanitarian crisis situations who may face additional challenges, definitely face additional challenges. In terms of products, we need to meet the needs of older individuals, and through that, again, we need to involve them directly in the design and testing of assisted products. If we think about and plan for the preferences and the lived experience of older people, products are more likely to be acceptable and effective. Alongside this, we need to foster policies and partnerships that not only make assisted products more affordable, but also ensure reliable supply chain, particularly reaching rural or remote communities. And from a WHO perspective, that means integrating assistive technology provision into primary and community healthcare. We also need to establish and uphold quality and safety standards, and products need to be safe, reliable, and appropriate for older people, with clear labeling and instructions tailored to their needs. When we think about the provision systems, we need to think about health systems that at the moment often concentrate on treating acute healthcare needs and often overlook or are not well equipped to address the functional needs of older people. But both social and economic return favours an age-friendly, person-centred and coordinated care model, including timely identification of need and access to assistive technology. So we need to integrate access to AT into primary and community health levels, as I've already said. And then in terms of personnel, in order for that to work, we need to respond effectively to the needs of older people by strengthening the skills and the capacity of the health and social care providers and others providing support to older persons, along with assistive technology specialists. So we need to raise the awareness amongst those frontline workers around supporting the need and the importance of access to assistive technology, as well as bolstering those with more specialist expertise on the provision of more complex products. We should think about training that is tailored to the realities of rural and diverse communities, and think again about ongoing evaluation and adaptation of equipment. And finally, on policy, we really need to think about policy as the bedrock of improving access to assistive technology. It needs to address the information systems, the financing, legislation, leadership, and governance. We need strong political commitment. We need adequate legal frameworks that identify the right to assistive technology, and we need sustainable funding in order to guarantee universal rights-based access for all. International instruments such as the UN Madrid International Plan of Action on Aging, the Sustainable Development Goals, the UN Decade of Healthy Aging, and the Convention on the Human Rights of Older Persons provide vital frameworks for this work. Each country should adopt a comprehensive action policy and action plan, obviously with budgeting behind that in order to ensure access for everyone, everywhere, without financial hardship. Easier said than done. In conclusion, I would like to say that equitable access to assistive technology is vital to upholding the rights, dignity, and well-being of older persons worldwide. And by promoting and integrating service delivery, building the skilled workforce, establishing supportive policy environments, ensuring meaningful user involvement, and fostering person-centered innovation in products, the 5P framework sets out a roadmap for achieving universal rights-based access to assistive technology. And we're very, very happy to receive more information from anyone that would like to know a little bit more about this work and how to implement the roadmap. Thank you.
We are grateful with you, Kaylee, for your time. Thanks for sharing your inspiring work. We wish you all the best in your endeavors. We will continue now with Dr. Ji Li from the Education Law at East China University of Political Science and Law from Shanghai. She's also part-time researcher affiliated with both the China-US Aging Research Center at the university and the School of Education of Jiangsu Open University. Her research examines the interdisciplinary field of aging, focusing on its intersections with education, theory, policy, law, and psychology. Welcome, Dr. Lee. Please, the floor is yours.
Thank you. Good afternoon and good morning, and distinguished chairs and fellow colleagues, and ladies and gentlemen. It's my privilege to speak with you today. And first, let me share my slides. Okay, this one. Okay. My title is Educational Gerontology. Gerontology as an empowering tool to combating discrimination against older people. And it is divided into 4 parts. And first part is about the problem. And as you know, China is now home to the world's largest adult population, exceeding 300 million people. So this demographic scale brings a severe challenging intersectional discrimination. It operates like an invisible web, permeating every corner of our society. Within families, it might manifest as tragedy of an older person falling and lying alone for days unnoticed, or as the cold rejection from adult children who dismiss their parents' desires for education, or remarriage as inappropriate. In public space, it reveals itself through harsh comments like, old adults shouldn't crowd the buses during rush hour, or they are taking up public resources by going to university, effectively attempting to exclude them from public life. And this is a news report in March this year. According to Economic Observer, rental challenging for senior over 60 become widespread. Children fail to secure housing for 65 years old parents after meeting 20 agents in 3 days. Property agents said some landlords fear potential disputes from unforeseen incidents. And this news report reveals a new discriminatory phenomenon in public spaces in China. And at the institutional level, it even more insidious. We see technological code violence in complex self-service kiosks that effectively lock old people out more deeply when witness systems failure, where caregivers in hospital who should be protectors become abusers due to gaps in institutional training and oversight. This is no longer merely individual misconduct. It represents a collapse of the entire support system. These cases are just the tip of the iceberg, but they reveal a harsh truth. Discrimination from the private sphere of the family to public spaces and into the core of our institutions forms a complete chain of discrimination. Part two, the solution. Why educational gerontology? It's a more fundamental tool for empowerment. As we know, the law as a hard constraint is a necessary tool for punishing extreme acts and setting societal baselines, yet its function is inherently reactive and defensive. It struggles to regulate everyday microaggressions, internal biases, and indifferent attitudes, thus possessing inherent limitations in eradicating ageism. So relying solely on the hard constraint of law to punish extreme acts is like pruning the branches while leaving the roots of discrimination deeply embedded in the soil of our society. So the answer lies in education. In contrast, the educational gerontology serves a more proactive and fundamental tool for empowerment. It focuses not on post hoc remediation, but on addressing the issue at the source by disseminating a scientific understanding of aging. It deconstructs stereotypes and through fostering intergenerational empathy, it cultivates a culture of respect. This inside-out process of cultivation aims to transform societal mindset, shape positive attitudes, and enhance competencies, turning respect for old adults from a legal requirement into an internalized social habit and moral consciousness. Its core value lies in empowerment and prevention. It not only protects old adults, but more importantly, empowers every one of us who is Asian. Ultimately, it shifts the governance model from a passive dare not discriminate, driven by legal deterrence, to an active choose not to discriminate, rooted in cultural consciousness, thereby creating the fertile social ground necessary for laws to be effective and achieving fundamental governance that moves from institutional constraint to cultural consensus. Part 3, the framework, a three-dimensional empowerment system of educational gerontology. The first dimension is education for the elderly. It targets old adults empowering self. And the core objective is to help them cultivate a positive view of aging, liberating them from the harmful narrative of being a social burden and enabling them to see later life as a period for continued growth, contribution, and enjoyment. This kind of education can enhance their ability to cope with aging and safeguard their rights and interests. And the second dimension is targeting professional empowering services. Those services include caregivers and social workers, doctors, and designers. Our goal is to move them beyond a task completion mindset and equip them with deep gerontological knowledge and genuine humanistic care. And the third dimension is to target the social public empowering culture. And it includes three domains: knowledge, providing accurate information; attitudes, reducing ageism and fear; and skills, building coping competencies. This equips people to handle personal, familial, and societal aspects of aging. And part 4, the vision towards an age-friendly learning society. Through this systematic educational empowerment, we ultimately aspire to build a genuine age-friendly learning society. In this society, old adults are respected as sages and vibrant participants. Every service interaction is infused with professionalism and warmth, and the younger generation no longer fears growing old, recognizing it as a new life stage with adequate support and inherent dignity. Therefore, investing in educational gerontology is not merely about solving a social problem. It is about paving a broad avenue toward dignity and well-being for our shared future. That's all. Thank you. Attention.
Thank you so much, Dr. Lee, for your thoughtful contribution and for bringing forward the perspective of education law and lifelong learning. Thank you so much. Now we continue with Dr. Ruben Ng from the National University of Singapore. He's an assistant professor at the Lee Kuan Yew School of Public Policy and lead scientist at Deloitte's Register Foundation Institute for the Public Understanding of Risk. Behavioral scientist trained at News, Oxford, and Yale. He has spent 16 years in the government, consulting and research. He's an expert in ageism, social gerontology, and quantitative social science. He's the first Singaporean and Oxonian to win the International Fulbright Science and Technology Award, and recently won Singapore's most prestigious prize for early career social scientist, the Social Science Research Councils. Please, Dr. Ng, the floor is yours. Thank you once again for your time. We should recognize that you have done a really important effort to join us today. Thank you once again.
Well, thank you so much, Miss Ana Lucia, for that really generous introduction. I think what she was referring was I just actually got off a flight. But normally after a flight, I'm really tired, but I'm just full of energy and really excited to share some of these learnings with you because I think it's such an important topic. And thank you so much for coming here together on a Thursday, Friday. Okay, so just a quick introduction. My name is Ruben Ng. As you can see, my last name or surname has no vowels. So when I spend some time in Europe and in the US, people always think NG is an abbreviation for no good. But I told them, no, it's not no good. It's a nice guy. So I'm a sort of behavior and data scientist by training, and I am very passionate about the topic that I want to share with you today on ageism and reframing aging. So my talk will be, so I have about 7 to 10 minutes. So my talk will be 3 segments. The first part is really talking about just aging as a whole, how it is it's a demographic phenomenon that we cannot ignore. That's the first part. Second is to talk about is really to elaborate on what Dr. Lee has mentioned previously on ageism. So I'll go a little bit deeper into our global study of ageism and what did we find, intersectional discrimination and things like that. Then the third, perhaps, is to touch on Miss Roxana's earlier mention of social media. So I'll talk about how we can use social media to reframe aging, because I think at the end of the day, the question for policymakers like us, people who do advocacy is what can we do about it after knowing about all these things. Okay, so I'll cover these 3 things. So I know I'm singing to the choir, but you know, in the past 3 sessions, you would have seen a lot of such statistics, right? So this is one such statistics that's really striking. By 2050, we would have 2.1 billion older adults. If you think about 2.1 billion, that's the entire population of China and US combined and even more, right? So the scale of aging is going to be huge. But to be honest, when I talk to governments around the world, they haven't quite grappled with what this really means, because it's going to fundamentally shift, right? Governments, governance, consumer trends, retirement pensions, it's going to fundamentally shift that. But I feel that the world is not ready for this demographic phenomenon that's going to come. And we are talking about more than 2.1 billion older adults by 2050. Now, it is really striking because if we look at a super aged society like Japan, we have seen that actually in 2015, the sale of adult diapers have now far exceeded the sale of baby diapers. Okay, so that's a really interesting phenomenon. And we have also done some projections in Singapore. Singapore is a rapidly aging society. In about 2 years' time, we will become super aged. Super aged means that 1 in 5 people in the country will be aged 65 years and above, joining the ranks of Japan, South Korea, Hong Kong, Taiwan, and so on, right? So, but the difference between Singapore and Japan is that Japan took 30 years to get to 30%. Singapore is only going to take half the time to reach a super aged society, which means that there are going to be a lot of changes that are compressed within a very short runway. And in Singapore, when we did some disability projections with the Ministry of Health, we found that actually disability will increase 5 times in the next 40 years, and social isolation will increase 4 times in the next 40 years. So we are talking about a whole demographic shift, but the implications of that demographic shift is a higher sort of prevalence of disability and social isolation. So second part now, just to talk about a global prevalence of ageism. Now, this is really important because when we look at ageism, typically it's studied in 30 or 40 countries, but I think we want to take a global perspective. So we partnered with Gallup, the survey sort of organization. They do a Gallup World Poll every year. So we partnered with them, added 3 questions about discrimination of age, discrimination based on gender, and discrimination based on skin color, and see which one actually has a higher prevalence across 140 countries, right? But before I share with you the findings, so these are very new findings. We haven't had a chance to write it up yet, so you are probably one of the first to hear this. But before I share with you those findings, I just want to quickly go into what do we mean by ageism. So ageism was a term coined by Robert Butler, who founded the National Institute of Aging in the US, and he defined ageism as a process of systematically stereotyping and discrimination against people because of their age. So we are not even thinking about whether the person is good at doing that. We're not looking at the person holistically, but stereotyping the person negatively simply because of a person's age. That's what ageism is all about, right? And he likened it to also other discrimination like sexism and ageism. So the Gallup World Poll, as I was mentioning, surveys 99% of the world's population. So after negotiating with them, we could only add in 3 questions. So these are very simple questions that we have asked in this Gallup World Poll that covered 140 countries, 99% of the world's population. Now, this polling is powerful because it is a nationally representative sample in every country across those 140 countries. And we asked 3 questions. Have you personally ever experienced any discrimination based on your age? Second is any discrimination based on your gender. Third is have you experienced any discrimination based on your skin color? Okay. So I just wanted to see what are the percentages of people around 140 countries that said they were discriminated based on age, gender, and skin color. And this is what we found. This is quite surprising to me, right? Because there's so much talk about gender discrimination, racial discrimination, and things like that. But actually, age discrimination is the most experienced discrimination as compared to gender and racial discrimination. So the prevalence around the world, 140 countries through the Gallup World Poll is actually 11%, meaning 1 in 10 people around the world. I think the whole sample was about 165,000 people across 140 countries. 1 in 10 actually felt age discrimination or reported to have experienced age discrimination. Okay, so this is quite surprising that age discrimination is the most experienced compared to other types of discrimination. Okay, so that's one key finding, was surprising yet not surprising to me. So after understanding that age discrimination is the most experienced discrimination compared to gender and skin color, we wanted to see actually how much people talk about age discrimination. Okay, so we did a social media analysis. So we gathered 150 million tweets over 15 years. Basically, we started when Twitter started in 2006. So so we collected about 150 million tweets around the different hashtags, right? Around ageism, sexism, and racism. 150 million tweets, and this is what we found. Let me take you through that. So the x-axis here is the year, right? So the first tweet about ageism, sexism, or racism started in 2007, and Twitter was founded, right, in 2006. And we analyzed it all the way to 2022, that's the x-axis. The y-axis is the number of tweets in million, okay? So what do we see here? The red line here is racism, black line here is sexism, and the blue line here is ageism, right? So basically, racism hashtags were used 60 times more. So basically, racism was talked about 60 times more than ageism, and sexism was talked about 24 times more than ageism. So what do we see here, right? It's very contrasting that age discrimination is the most experienced discrimination, but the least talked about. Okay, that's the fundamental point I want to make. It's the most ageism is the most experienced, but least talked about. And we went on to try to analyze. I don't really have this here because the talk is very compressed, but we looked at it on a daily basis, right? From 2007 all the way to 2022, every day, what caused spikes in the chatter on social media about ageism, sexism, and racism. And for sexism and racism, the incidents that cause spikes are very emotional, such as George Floyd killing in the US. It caused a spike in sort of racism conversations. So those incidents, very emotionally charged, cause these spikes, right? But what caused spikes in conversations around ageism? It's just academic conferences, right? So let's say there's the International Day of Older Persons, there'll be a little bit of spike, right? So basically, what is happening here is that ageism seems to be taught within professional circles. It hasn't really percolated, or it hasn't really gone out to everyone talking about it, right? Because people are not as much aware. Okay, so I think that's something we need to learn. How can we try to understand how advocacy is done with regard to sexism and racism, and how can we use that to encourage more conversations around ageism, because it is actually the most experienced form of discrimination based on that global survey that we did. Okay, so the upshot really is that age discrimination is the most talked about, it's the most experienced, but the least talked about. Finally, in just 1 or 2 more minutes, I just want to talk about, okay, after understanding this, what can we do about it? Okay, maybe I'll skip this too and talk about reframing aging. Now, as a data scientist, my team actually compiled the largest historical corpus of the English language. So this was basically since 1810 all the way to 2020. So 200 years basically. We collected 600,000 sources of magazines, newspapers, fiction and non-fiction, to try to understand actually what are the origins of this age discrimination. Were older people 100 years ago also talked about negatively, right? When did it begin? Okay, so we wanted to look at that. But more importantly, this is what we found. It's a bit complex, so let me unpack this for you. The x-axis is the decade, right? So every decade for the last 20 decades, from 1810 all the way to 2010. And the y-axis here is this aging narrative score, right? So if you go further up the y-axis, it's actually more positive, right? If you go further down, it's actually less negative. So what did we find here? We find that when we do age-based framing means we refer to older adults based on their age. Senior citizen, elderly, where we foreground their age, okay? Role-based framing, the red line here, is when we refer to them based on their family roles, like grandparents, grandmother, grandfather. What do we see? When the black line here, when we refer to a person based on the age, like senior citizen, older adult, right? You foreground their age. Actually, it attracts a lot of negative stereotyping in the last 200 years. See, the line is quite steep, right? It's going down, okay? But if you refer to older adults based on their family roles, like grandparents, grandparenting and things like that, it's not as negative, okay? So the point here is this. Okay, just one more here. So you see 2 centuries, right? 1800 and 1900s. The percentage of positive topics. So you can see age-based framing, right? The square here. That means if we refer to older adults based on their age, senior citizen, older adults. In the 1800s, 82% of positive or neutral topics, and the percentage of positive or negative topics when you talk about age actually decreased from 82% to 38%. In contrast, when you refer to older adults based on their family roles, like grandparents, grandmother, grandfather, the positive topics went from 71% in the 1800s to 89% in the 1900s. Okay, just one more slide to bring home the point. We talked about family roles, right? What if we refer to them professional roles, these occupational roles, okay? So the red line here is you refer to older adults based on their professional roles, okay? Like older doctors, older lawyers, older carpenters or whatever, right? The blue line here is like in the previous slide, you refer to them based on their family roles, like grandparents, grandmother, grandfather. The black line here is when you refer to them based on their age, like senior citizen, older adults, and so on, where you foreground their age. When you refer to older adults based on their age, you can see here very negative stereotyping in the last 200 years. If you refer to them based on their family roles, the blue line here, less negative stereotyping. But if you actually refer to them based on their professional roles, in fact, there's you see the red line here, it's in contrast, it doesn't go down, it actually goes up. So if you refer to older adults based on their professional roles, you actually attract more positive stereotyping, more positive topics about older adults. So I think if you forget everything that I've said, I just want you to remember this, that words really matter. How you talk about an older adults, whether we sort of focus on their contributions to society, is a lot more important than talking about age and vulnerability. Okay, with that, thank you so much.
Oh, you have a lot of energy. Thank you so much for stressing on the linkages between demographic changes and its implications combined with intersectional discrimination. And just for the record, you are not just a nice guy, but you are also a doctor with a lot of experience in the field of data scientists. So we are quite lucky of having you today with us. Thank you so much once again. Now, it's such a pleasure to welcome back Dr. Jody Heyman. She is the founding director of the World Policy Analysis Center and served as dean of the UCLA Fielding School of Public Health from 2013 till 2018. At World Policy Analysis Center, Dr. Heyman leads an unprecedented effort to improve the level and quality of comparative policy data available to policymakers, researchers, and the public, which examines health and social policies and outcomes in all 193 UN countries. Dr. Heyman previously held a Canada Research Chair in Global Health and Social Policy at McGill University, where she was the founding director of the Institute for Health and Social Policy. While on the faculty at Harvard Medical School and at the Harvard School of Public Health, she founded the Project on Global Working Families. She has received numerous honors, including election to the U.S. National Academy of Medicine in 2013 and the Canadian Academy of Health Sciences in 2012. Dr. Heyman has authored and edited more than 500 publications, including 19 books. Welcome back, Dr. Heyman. The floor is yours.
Thank you so much, Ana Lucia, for the kind introduction and for organizing this. And so fantastic to hear what everybody had to say this morning. Just really tremendously interesting and important. So I've now learned how to introduce myself from Ruben. I should give my professional, and then I should say I'm a grandma. So I will do that in the future. I'm going to talk about what happens in the workforce. So there are a lot of older people who still want to work. There are a lot of older people who still need to work. Work matters across the life course in terms of our health. It matters to our social connections. It matters to meaning, purpose, income, so many areas. And it's an area that's ripe with discrimination. As I talk about it, I do want to say I really share the sense that I think came out in both G and Ruben's talk about the importance of changing norms and being aware of norms. I also think we have to change laws and policies that shape discrimination. We need both. We need both sets of tools. Like Ruben, I'm a data geek, so I'm going to show you a bunch of global data on the topic. Let me just share screen on this. Can somebody give me a thumbs up to show they can see the screen? Perfect. Okay. So the center I lead, the World Policy Analysis Center, is the largest center collecting global data on what all 193 UN countries are doing in policies across a wide range of areas from childhood to through adulthood and older age, across education, work, climate, and a variety of other areas. I mention that just because all of our data is freely downloadable. It's available in 6 languages, and that's why I share that it's at worldpolicycenter.org. It is disability accessible, and feel free to reach out. I'll give email addresses at the end so people can reach out if they want to access it and have any challenges. We've already heard that age discrimination is widespread overall. It's also widespread in the workplace. The evidence of this is really clear. I'm just going to, for time, I'll just give a couple quick examples. You can send CVs for a job that are exactly identical, except how they indicate age, and the older person will get less callback. That's interview invitations. That's true for men, that's true for women. It's more true for women. This is intersectional bias. Both experience it, but the stereotypes about older women are worse. By the way, there's plenty of data that many of the stereotypes are inaccurate. Just take one area, productivity. From lawyers to factory workers, they've studied it. If you measure productivity not just by speed, but speed and accuracy, older workers perform just as strong as younger workers. Their pace may be somewhat slower. Their accuracy is higher. In terms of total productivity, there aren't differences. So we both have evidence on the discrimination, bias, stereotypes, and we have counter evidence on how similar people are. Another common area is people's assumption that older workers don't learn tech. They learn tech. You give them the same number of hours, they'll learn just as much tech. Okay. As I mentioned, we should care about it just like we care about each area of life, people having full access to. But there are enormous benefits to work. So in addition to norms, what would we try to do if we wanted to address this with policy? We take the first step that we do for every other area of discrimination in the workplace. We would say employers aren't allowed to discriminate. Is that enough? Of course not. There's a ton to do on implementation. I'll get there. But at a minimum, you have to say they can't. So where I don't know, it depends if you're a glass half full, half empty person. 65% of the world's countries do prohibit age discrimination in the workplace. That's the good news. 2/3 have started. The bad news is in a third of countries, it's perfectly legal to discriminate based on age. And in many of the countries, employers are getting better at it, not worse. Technology, for example, allows advertisements to jobs to be micro-targeted to age groups. I want to hire this ad to only go to 25 to 29-year-olds. Is just one example of that. I mentioned at the beginning the additional discrimination that women face. Of course, other groups who are marginalized also face multiple forms of discrimination as they age. We've talked about intersectionality in different ways in this webinar, but I'm going to focus on to what extent older adults in different marginalized groups are protected against discrimination based on all of their identities. Well, 9 countries have age discrimination, but not disability discrimination, no protections there. Since 46% of people over 65 have a disability globally, that means they're facing a discriminatory risk there. And also gaps in terms of race, ethnicity. If you look at the biggest gaps, though, the biggest gaps in terms of these multiple forms of discrimination are for immigrant older workers and older workers who are sexual and gender minorities. I'm going to show some maps here. So this map shows which countries in the world have an explicit prohibition of discrimination based on age. And we see a few things. These prohibitions or protections are widespread in the Americas. They're widespread in Europe. A good portion of Africa has it, even though it's our youngest continent, but a significant number of countries don't. And there are a lot of countries across Asia lacking it. Still, we see a picture where the majority of the world does protect until you talk about intersecting statuses. Only the countries that are green on this map protect older immigrants from discrimination, both based on their migration status and age. You can see it's far fewer. The number gets even smaller if you talk about older adults who have who are facing discrimination based on sexual orientation, and even fewer countries protect older adults who are gender minorities. So one of our big gaps globally in terms of legal protections are these multiple forms of discrimination and intersectional discrimination. The other big gap is in implementation. Now I'm going to focus for a moment on those 65% of countries that do prohibit age discrimination. When we look at just age discrimination, we ask, were employers required to take any measures to prevent it? It's very few countries. It's only the green countries on this map where it was both illegal to discriminate and employers were supposed to prevent it. All the rest, there were no requirements for prevention. And then when you talk about can people have an opportunity to redress discrimination? What happens when someone comes forward and says, I was discriminated against based on my age? Can the employer retaliate against them? Yes, in most of the world, the employer can retaliate. Only in the green countries, again, are they protected from retaliation for reporting the problem. We have much more data on the intersections, but also on what's being done around implementing them. I just wanted to briefly share email addresses so that for people who want to follow up. But I just want to end by saying we need to change the norms, but we also, part of changing the norms is changing what countries say is allowable and not. Too often right now, we say it's allowable to either discriminate against all older adults or it's allowable to discriminate against minorities. Taking those steps is in all of the global agreements, but it's not yet in our national laws in all countries. And it's an essential first step. Thanks very much. It's really a pleasure to join everybody here.
Thank you so much, Dr. Heyman. As always, it's a pleasure to learn from you. To continue, we will give back the floor to the speakers, and we are really grateful with the participants who have shared some questions through the chat box and also through other means. Thank you so much. We are trying our best to cluster the questions for the speakers. Some of you as the speakers have already replied to some questions, but for the sake of time, I'm going to cluster two questions, and the first cluster would be for Doctors Lee, for Dr. Heyman, and Dr. Rubin. So here is the question for you. Each one will have 2 minutes, please. A quote from a TV series laments that in the past, older persons were seen as wise and respected, but now they are just seen as another time. How do shifts in family roles contribute to the stereotype of older persons as being from another time? And what evidence-based strategies can be implemented within family units to actively challenge this stereotype? Please, Dr. Lee, you have the floor.
Oh, okay. Thank you for these very brilliant questions. And actually, I think education is a very strong tool to solve this problem. And the most important work for old adult education is to shift the stereotype to a very brilliant opinions about the Asian. And this is I ever remembered, there is a story about old people. After he went to the school, he changed his family role. And in the past traditional culture, and the grandparents always take responsibility to upbring their grandsons for their sons or daughters. But after the old people went to the school and learned some modern culture in our society, he changed his mind, and he spoke to his son and daughters. I want to live my life. I would never take the responsibility for your for your role. So I think these examples is the best evidence to support this these questions. I think education is the fundamental tool to empower the empowerment. Yeah. Okay.
Thank you, Dr. Lee. Now we continue with Dr. Ruben, please.
Sure. Thank you so much for those important questions. So I'll just follow on from what Dr. Lee has mentioned. I think the insidious thing about stereotyping is that you're reducing a person to something, right? Which shouldn't be. The idea here is that we can't just look at a person and say, oh, this is the person's family role and things like that. The idea here is to look at a person holistically, appreciate the person for who he or she is, beyond just family roles, professional roles, and a combination of different things. I think that's the key upshot and main point I want to highlight. We need to look at people as holistically as possible instead of reducing them to different roles and stereotyping based on different roles. So that's point number one. Point number two, I just wanted to elaborate a little bit more the historical study of how older people have been portrayed in the last 200 years. Now, from 1810 to 1880, actually older adults were portrayed very positively. We talked about older adults from 1810 to 1880 as heroes, as romantics. In 1880, it became neutral. And from 1880 all the way to 2020, it has been heartbreakingly sort of negative. And the reason for that is that in the last 50 years, every time we talk about older adults or aging, there is this thing, we talk about older adults in a very medicalized form. In the last 50 years, when we talk about older adults, it's always about their illnesses and treatment, dementia, Alzheimer's, a very over-medicalized form of talking about aging and older adults. Now, when we found out that that was the case, we quickly convened a meeting with journalists to tell them that, look, it is okay to report about dementia and Alzheimer's, perfectly fine. It's a public education. But every time you talk about dementia, Alzheimer's, and things like that, please highlight a positive example, because it is really important that there is unintentional negativity, but let's highlight somebody who is doing well. Let's highlight resilience so that you balance up the negative stereotyping with positive ones. And I think doing something like that overall will get a more holistic perspective of aging instead of medicalizing aging and focusing only on the negative aspect of vulnerability and aging.
Perfect. Thank you so much. Now, Dr. Hyman, and also Roxana, if you want to chip on.
Yeah, I don't think we're going to change attitudes merely by telling people to change attitudes. I think we're not going to change attitudes till we change older people's lives, till they're able to be engaged equally, which overwhelmingly older adults want to. They want to be active in the community. They want to be active in their families. They want to be active at work. I should, instead of they, say we. But, and so what's that mean? I'll start with the family because that was the question. And there are simple things policies can do. A number of countries have policies where grandparents can take the parental leave, where parents, single parents, can share it with a grandparent, where two-parent families where they want to be at work and a grandparent wants to contribute can. The way we structure who can be and have agency and provide care as well as receive care shapes how active grandparents can be. I've already mentioned work and discrimination, assistive technology that we heard about. There are communities where AT makes participation in recreation widespread, where what is available makes it widespread across disability, ability, and across age groups. Same with ICT and engaging with your family. When we make it possible for people to be as engaged with family, friends, community, work, politics, as most people want to be, then they will be seen for the whole lives they're living.
Thank you so much. Now, Roxana, if you want to chip in, and then we have a special question for Kaylee.
Thank you very much, Ana Lucia. So I cannot agree more with the speakers, but I was trying to think a little bit from another perspective, more technological part, because I believe that the shift from extended to smaller mobile and digitally driven families has weakened daily intergenerational contact and reduced the traditional role of older adults as our guidance or decision makers, even reinforcing the stereotype that they belong to another time. And I think that regular and meaningful intergenerational interaction is key. So families can do this by sharing learning across generation. For example, again, young members helping with digital tools, while older persons share their life experience, and by including older adults in family discussion and decision. So such practices strengthen mutual respect and help redefine a little bit aging as a source of connection, not disconnection. And I want to say that ITU, already 3 years ago, we developed a report in aging in the digital world from vulnerable to valuable. And actually in this report that we developed, we address some of these exact issues. And as said during my presentation, a very, very nice example of concretely addressing this topic is happening right now with the collaboration with Juventus universities in Japan. And we are employing throughout Asia and Pacific projects that are intergenerational. So students from universities are actually interacting with older person and sharing experience in order to, from their size, to make them familiar with technology, and in the same time also enrich their knowledge with, let's say, some life experience or whatever capabilities that this older person may have in cooking or other areas. So I definitely would like to conclude that intergenerational interaction is key, and we all have to keep in mind that everybody hopefully would get old, and we have to respect this this status and this condition, and do all our efforts to together let's say rewrite the storytelling about older person. Thank you.
Thank you so much, dear Roxana. And now let's go with Kaylee. This is the question from one of the participants. Given the rise of assistive artificial intelligence and neurotechnology, what is the most critical safeguard to protect the privacy, and cognitive liberty for older adults, older persons, particularly when their capacity for ongoing informed consent may be compromised?
I'm not sure that I'm the ideal person to answer that question. I think Roxana has already given a really good answer in the chat. So, digital technology, of course, comes with risk, and it's really important that the right safeguards are put in place. But that's across really all IT. And so, I could have a stab at it, but I think we're better off asking Roxana to give a little bit more information around that. We have the proper expert on the call for that. So over to you, Roxana.
Thank you, Gally. So I will share a little bit what I already put in the chat, because I responded from the IT and technological perspective that indeed the single most critical safeguard to protect the privacy and cognitive liberty of older adults and of all people in general in the age of assistive technologies, and in particular considering the evolution of the emerging technologies such as artificial intelligence. So I think it's to keep in mind the implementation of human-centered and right-based design and adaptive informed consent mechanism. So we are all trying to do this. We know that Europe is trying to develop a lot of and to advance on this topic, and to many other countries. So, and we are all in agreement that technology should serve the people. So it's valuable when it's designed for us, with us, to respect our rights and our rights. So ensuring that technology used to support older person is inclusive, transparent, secure by design, allowing individuals or their trusted representative to review, modify, or withdraw content as their circumstances change based on the evolution. And finally, I also indicate that we also have to call for robust governance frameworks and international standards that uphold privacy, autonomy, and ethical data use in line with ITU's work and IT for Good, of course, digital inclusion and trusted digital ecosystem that empower all people to benefit safely from all this technological progress and innovation. So I hope this gives a little bit of glance, at least from a technological perspective. And of course, nothing can be done unless we all advocate for this type of technology development. Thank you.
Thank you so much, Roxana. Technologies now play a pivotal role as a frontier issue for different topics. It's a cross-cutting element everywhere. And I'm quite sure that as part of the 5P strategy, the framework that you have been working at the WHO, technologies could be a wonderful means to implement the 5Ps. So it's really good to learn from you, dear colleagues, dear friends. So thank you so much for having joined us today and for your active engagement throughout this important discussion. Before we close, we warmly invite you to join the 5th and last event of this year's series, the 4th year of the series, and it will be focused on increased demographics, urbanism, and the right to food for older persons, and it will take place on Thursday, 13 November 2025, from same time, 3:30 till 7 CT time on Zoom. Thank you so much, and we wish you all the best in your endeavors. Thanks.
Thank you all
very much. Thank you.
I know there were some unanswered questions. Maybe Ana Lucia, we can send answers to people afterwards for the unanswered questions in the chat. Thank you for hosting this.
We
very
can share
much.
the answers
Bye.
with the participants. It will be a pleasure. And remember that we need to prepare the takeaways document. And if you want to share any special links or your PowerPoint presentations, you would be more than welcome. Thank you so much.
Thank you. Bye.
Thank you.
Bye.
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 Thank you.
Bye.
Thank you so much.
Thank you,
Bye.
everyone.
Hey.